After many months, a global pandemic, and many other changes, it's welcome news that early on and Indigenous-led programs may now choose to begin offering outdoor programming. This module intends to outline expectations, provide points of reflection, and answer questions to help with deciding whether or not to open or plan for reopening outdoor programming at this time. More detailed information can be found in the Early On Outdoor Program Guidelines document. Outdoor programming is defined as early on programs and services that are provided outdoors, either on public or private land, that align with the early on core service requirements. Early on outdoor programs must meet the following requirements: Toronto Public Health infection prevention and control requirements, pre-registration and screening, incorporation of the mandatory core services, publicly available information on services provided, open and free access, community-informed programming and delivery, service level requirements, and an inclusive and equity-based approach. Organizations that provide services through subcontracted agencies are responsible for ensuring their organization and their subcontracted agencies comply with all the requirements. Before anything else, you need to decide if offering outdoor programs is the right decision for your community, your staff and colleagues, and your organization. You will need to weigh a variety of factors such as organizational capacity, staffing, community interest, and others. The decision to offer outdoor programming is entirely up to each organization. As the decision is being made, it is important to be reminded of some of the many benefits of in-person outdoor services at this time, including opportunities to connect in person with the children and families that you know and love, meeting new children and families to build new connections, more chances for families to ask sensitive questions, gain support, and access key community supports that they need. Access to programming for those who are unable to sign in to virtual services due to limited internet, devices, safety in their homes, or other reasons. Ability to connect participants to each other, to break the isolation, and share support and resources. To support the physical, emotional, and developmental well-being of participants of all ages. To break down the idea that being physically distant means being socially isolated. To counter the myth that small children should not be outside when it's cold. And to model the myriad of ways to use the land and environment to support children's curiosity and learning. Outdoor programming also lets community members know that you're there. Walkers by may become curious. Consider a sign in your public space. There are a number of things to do before you can offer outdoor programming. Once the location has been secured, the community has been engaged to ensure they are interested, policies and procedures have been modified, everyone is trained and prepared, and plans are in place relating to space and supplies, you will be ready to go. There are many important reasons why organizations are keen to get up and running with outdoor programming, and no doubt the desire to connect with local families and care providers is at the top of the list. How have you engaged community in the decision to open outdoor programs? Is there a way to engage community members that are not regularly accessing your programs to see if outdoor programming is of interest to them? And will they feel comfortable engaging in outdoor programming at this time? Are there barriers to attending outdoor programs that you have heard and can mitigate, such as appropriate clothing and information about the public health measures that will be in place? Community engagement is crucial now more than ever. It's not surprising that planning outdoor programs includes ensuring the right paperwork is in place. Once your outdoor space is being selected, it's time to make sure it's okay to proceed and that the documentation is in place. Here are some considerations. Is the space owned or leased? Is the outdoor space already part of the rental or lease agreement? If not, can it be included or negotiated? Will the space be shared with others? If so, what arrangements have been made to share this space safely? Who needs to be informed? Are you planning on using public space, such as a city park? If so, has the permit application been approved? Keep the following things in mind when you are reviewing potential spaces for your outdoor programming. You will need space for registration, screening, and recording table, including physical distancing of participants waiting. You will need to have visible signage for the program and Toronto Public Health safety posters. Space needs to account for physical distancing. Administrative and Infection Prevention and Control, also known as IPAC, policies and procedures must be created or updated to ensure that mitigation measures to help reduce the spread of COVID-19 are included. COVID-19 related policies and procedures must address the following topics: the pre-registration process, the screening procedure and tool you plan to use, attendance recording, maximum group sizes, physical distancing, hand hygiene and respiratory etiquette, enhanced cleaning and disinfection, requirements for the use of toys, equipment, and other materials, use of personal protective equipment, and communication with families, caregivers, and other stakeholders. All early on staff must be trained and be able to demonstrate a solid understanding of the new policies, procedures, and practices to ensure the health and safety of everyone involved in the program. This module, alongside the PPE and IPAC training modules developed by Toronto Children's Services for early on service providers, must be completed prior to opening. Take a moment to consider what types of ongoing support you and your staff will need to achieve a high level of knowledge, understanding, and adherence to the new policies and practices. Ask your manager or colleagues if you need help understanding the new practices or want to find different ways to plan your programs to accommodate them. Early on service providers must keep a record of all staff that have completed the training modules and reviewed the necessary policies and procedures. In preparing the outdoor space and gathering supplies, consider what items you will need for the screening and registration table, signage, hand hygiene, defining the space, used and mouth toys, garbage, proper PPE usage, your programming, information and resources for families, and of course, how you will transport the supplies if the space you're using is off-site. Here are some additional considerations. The attendance recording area must allow for a minimum of 2 meters, 6 feet distance between staff and the individual signing in. Visible signs are needed clearly explaining the attendance recording and screening process and the rules and conditions for program participation. Tape, signs, or other visual markers on the ground and table will help maintain physical distancing. Hand sanitizer must be provided for participants to use after signing the attendance record. Toronto Public Health has downloadable signs that you can post to raise awareness about health and safety measures that can help prevent the spread of COVID-19. Organizations are encouraged to think about the services they provided indoors and innovative ways those services can be provided outdoors in all seasons. The context of the COVID-19 pandemic should also be integrated to support families by providing opportunities to discuss the impacts of COVID-19, such as social isolation and mental health issues. The impacts of COVID-19 have exposed and deepened inequities experienced by Indigenous, Black, and other communities that encounter barriers to equal access. Early on providers are encouraged to consider how they can contribute to minimizing the varying impacts. All 3 mandatory core services should be incorporated into outdoor programming, including engaging parents and caregivers, supporting early learning and development, and making connections for families. Early on providers should re-engage with their communities to identify their current needs, including the types of supports participants would benefit from, themes, activities, discussions to focus on, and the best times for services to be offered. Early on outdoor programs and services should actively promote and use an inclusive and equity-based approach. Programming should reflect the experiences, voices, and strengths of children and families with diverse cultural identities and abilities. Services should enable participants of various developmental stages and diverse learning styles to participate to the greatest extent possible. Engagement with families and caregivers should be used to inform how best to provide inclusive and responsive programming. You are now required to have participants pre-register in order to attend all outdoor programs, which means for the time being, the usual drop-in services are on hold. COVID-19 screening must be done by every staff, program participant, and essential visitor to the program without exception. Enhanced attendance recording is now a requirement as well. You must develop an easy-to-use pre-registration process for participation in outdoor programs. Pre-registration allows you to have the necessary information if Toronto Public Health requires it for the purposes of COVID-19 contact tracing and to follow up as necessary. It will also assist you in ensuring that your program does not exceed the capacity limits needed to ensure that physical distancing of 2 meters or 6 feet can be maintained between households and staff at all times. Non-registered visitors must not be permitted to attend. Set up a screening area that you must pass through before entering the outdoor space so that every single program participant, staff, and visitor is screened prior to entry. Consider how you will communicate the screening questions and requirements with people who speak a variety of languages, and keep literacy needs in mind as well. Hand sanitizer of 70 to 90% alcohol concentration should be available at the screening table and throughout the outdoor space. Parents and caregivers should be reminded of the screening questions when registering for programs online or by phone, and through visible signage at the entrance. During the in-person screening, participants must verify in writing that they have completed the screen with no responses prior to entry to the Early On outdoor program. Anyone who answers yes to any of the questions must not be permitted to participate. Refer these individuals to the Toronto Public Health website to learn about assessment and testing. Screening records must be kept for 12 months. Keeping daily attendance records of everyone participating and visiting outdoor early on programs is essential. You must collect the following information: name, company if applicable, contact information, date and time of arrival and departure, the reason for the visit, area visited, and an adult signature verifying no responses from date of program screening results. Besides staff and program participants, this includes, but is not limited to, maintenance workers, partner organization staff, and government agency employees. How will you ensure confidentiality and privacy of your attendance records? Remember, records should be kept for 30 days and then shredded. Your outdoor IPAC program should include physical distancing, hand hygiene, enhanced disinfecting practices, protocols for outdoor equipment, and toy cleaning plans. Food safety is not an issue at this time, as early on programs cannot provide food of any kind at outdoor programs. Assess the outdoor space you plan to use with optimal physical distancing and accessibility in mind. Move benches or seating areas to ensure physical distancing of 2 meters or 6 feet, and make other modifications as needed. Remove chairs around tables from outdoor program spaces To avoid participants from congregating, install hands-free garbage bins where possible. You may want to try and visualize the flow of participants and imagine them moving through the space. Are there areas where congregating is more likely? Are there minor adaptations that will make it easier for physical distancing and flow? How will someone with a physical disability or mobility issues navigate the space? Ask yourself, where will participants keep their belongings? Where will strollers go? How many hand hygiene stations can you set up? How will you keep mouthed and used toys out of reach? What additions or changes will be needed as the weather changes? What might you need on snowy days or high temperature sunny days? Practice physical distancing to maintain a 2 meter or 6 feet distance between staff, children, and parents and caregivers. Parents and caregivers do not need to maintain physical distancing with their own children, and distancing measures should never compromise the safety, emotional, or psychological well-being of children in the program. Encourage participants to greet each other using non-physical gestures like waving, nods, and words, and avoid close greetings such as hugs and handshakes. Perhaps a fun game or activity can be created to reinforce these important measures. Plan activities that encourage spacing while promoting social interaction. Avoid activities that involve shared objects or toys such as balls. Staff may need to remind children and adults to keep their hands to themselves and about the no sharing policies and procedures. The practice of not sharing food, water bottles, or other personal items may be hard for program participants to keep in mind at the beginning. Here are some tips to promote safe social distancing. Limit the number and types of personal items that can be brought into the outdoor early on program. Personal items like soothers and water bottles must be clearly labeled with the participant's name to prevent accidental sharing. Designate and manage entry and exit points to control the number of participants. If the maximum number is reached, allow one person in for every person that leaves. Stagger arrivals and departures to reduce congestion at points of entrance and exit and in common areas. Wear a mask or face covering when it is difficult to maintain physical distancing. Remind participants not to put a mask on children under the age of 2. And if using open outdoor space, use barrier structures to enclose the outdoor space to manage capacity and flow. Ideally, specific washrooms should be designated for your program when possible to do so. If it is in your control, avoid having people from different programs be in the same washroom at the same time. If the washroom is within your organization, clean and disinfect at least twice daily or in between groups. You may need to monitor and clean more if needed. Disinfect high-touch surfaces such as grab bars, railings, door handles, faucet handles, and bathroom surfaces more often. Check and refill liquid soap and paper towels regularly. Where possible, open windows to allow for airflow and ventilation. If you are using public space, consider your washroom protocol and what you want to communicate to staff and participants. Thorough and proper hand hygiene is a key element of your IPAC program and cannot be emphasized enough. Early on staff must ensure that proper hand hygiene is practiced often and when necessary. For example, after using the bathroom, after covering a cough or sneeze, after contact with a high-touch surface such as a doorknob or handrail. Remember to avoid touching your face, nose, and mouth with unwashed hands. Cover your cough or sneeze with your elbow or a tissue. It's also important to immediately throw the tissue in the garbage and wash your hands. Make sure to provide enough hand sanitizing stations, and sanitizer must be within the 70 to 90% alcohol concentration range and can only be used if hands are not visibly soiled. Ask participants to sanitize their hands before and after using outdoor equipment and upon arrival and departure from your program and immediately after outdoor play. Early on service providers must monitor hand hygiene supplies to ensure adequate amounts of hand sanitizer, tissue, and garbage cans lined with plastic bags are available. Even in the outdoors, enhanced disinfecting practices should be implemented. Toys and equipment must be made of materials that can be cleaned and disinfected. Do not use plush toys. Suspend group sensory play and move to individualized bins with art materials and supplies for each child. Assign toys to one outdoor early on program. If possible, use a color coding system or another type of identification system. Consider having disinfecting bins around for used and mouth toys. Mouth toys, or toys that come in contact with bodily fluids, must be removed from play immediately and placed in a dirty toy bin for cleaning and disinfection. Toys and equipment, including outdoor play equipment, must be cleaned and disinfected at least twice per day and ideally in different between groups. It is important to remember that cleaning and disinfecting are different. Cleaning removes dirt and impurities, but does not kill germs. Disinfecting with Health Canada approved product or a chlorine bleach is needed to eliminate COVID-19 from toys and surfaces. Make sure to note the contact time, which tells you how long the disinfectant needs to stay wet on a surface before drying or wiping down. To clean and disinfect toys, you can use a mechanical dishwasher or a 2 to 3 sink method. Wipes can be used to disinfect equipment and play structures that are large. Items that cannot be easily disinfected, such as books, should be taken out of rotation after use and placed in a sealed container for 7 days before reusing. Make sure to maintain logs to track cleaning and disinfecting activities for each outdoor program. Staff and program participants must not attend outdoor programs when they are ill, and any symptoms associated with COVID-19 that arise during programs should be reported to early on staff. Exclude participants and staff that become ill. If a staff and or a parent caregiver becomes ill with symptoms while at the outdoor early on program, immediately separate them from the rest of their group. Send them home. Refer them to a COVID-19 assessment center and Toronto Public Health's COVID-19 information. It is recommended that the staff and participants with symptoms of COVID-19 go for testing as soon as possible and self-isolate at home until their results are available. Clean and disinfect the area immediately after the participants with symptoms have been sent home, and wear personal protective equipment while doing so. Early on staff and participants exposed to a confirmed case of COVID-19 must be excluded from attending any early on program for 14 days. Self-isolate at home and monitor for symptoms. Get tested as soon as symptoms develop, or, if asymptomatic, get tested any time within 14 days of the potential exposure. They must continue to self-isolate for 14 days even if the test is negative. Early on staff and participants who are being managed by Toronto Public Health, which is anyone with a confirmed or probable case of COVID-19 or close contacts of cases, must follow Toronto Public Health instructions to determine when to return to the early on program. Negative test results are not required to return to an early on programs. Early on service providers must immediately report laboratory confirmed cases in children, staff, parents and guardians, volunteers, or students to Toronto Public Health. It is important to keep the lines of communication open and let the community know that your Early On is offering outdoor programming and what they can expect. Make it clear that the Early On programs are free, accessible, inclusive, and ready to serve all communities. Consider how your community will learn about your programs from websites, emails, phone calls, posters, or through social media. Using multiple platforms may help you to reach different audiences, and consider ways you might reach people who do not regularly access your services. Work on outreach and communication plans to provide program information and protocols on health and safety measures such as screening practices, physical distancing, and staying home if you are sick. Communicate with partners and stakeholders such as building owners and property managers to provide updates about policies and procedures and to align any gaps or concerns regarding infection prevention and control practices. During programs, each adult participant should be asked to agree to a code of conduct, including physical distancing and frequent hand sanitizing. If unwilling to follow the code of conduct, they will be asked to leave the Outdoor Early On program to protect the safety of all participants. Toronto Public Health will provide guidance about what information should be shared with other staff, parents, and caregivers if there is a case or outbreak of COVID-19 at the Outdoor Early On program space. It's really important that you feel comfortable, safe, and supported at work. Employers must have policies and procedures for staff safety, including for IPAC. Mental health and wellness are also important elements of health and safety. As an Early On practitioner, you are in a caregiving role. As you listen and support the struggles of families, you may also have your own struggles. As you work hard to prepare the spaces to help your participants feel safe and comfortable, you may also be worried and anxious about COVID-19. Maintaining wellness, taking care of yourself, even in small ways, and having opportunities to share your feelings with trusted people are important factors in staying balanced and resilient. As you prepare to support your participants, consider what support you need as well. The next slide demonstrates the varying degrees of burnout and how to identify in COVID times when you are approaching it. Be familiar with the signs of burnout and your own warning signs. Mental health supports are available, and there is no shame in seeking them out. This concludes the outdoor programming reopening module for Early On, which is just one part of helping you prepare for running in-person outdoor programs. If you need additional support, please speak with your manager or supervisor. And Early On providers can reach out to their Children's Services Early On consultant at any time. We wish you all the best as you expand your programming to meet the needs of children and their families and caregivers in your communities.